Hello, everybody. Happy Tuesday. Wonder how it's going in your neck of the woods. But I'm here in Philadelphia and I have a treat for you. Soon you're going to be hearing from one of the world's most famous feline veterinarians and a good friend of mine and a woman who is two tons of fun. But we're going to be talking about senior cats. And I don't know if you've heard, but Basepaws is working on something called the Project 25 and hoping that with the advancements that they're making with genetic research and the contribution to feline medicine, that by 2025, we can have tools to extend our cats' lives to 25 years. That feels amazing, and we'll see. But I'm super excited to have so much energy with companies like Basepaws focused on these goals just for cats, because usually we're focusing veterinary goals on dogs, and it's like, yeah, oh, by the way, cats, but not here, and not with my friend. So with no further ado, I'm excited to introduce you to Dr. Margie Scherk, who is the co-editor of the Journal of Feline Internal Medicine and Surgery. She is lectures to other veterinarians around the world, teaching us the latest and greatest and most important information about cats. And now she's going to tell you. How cool is that? Hi.
Hey, hi. So I'm in Vancouver and it's kind of gray here and it's rainy and a bit chilly. What's it like in Philly?
It was beautiful today. I have to say, I think Pennsylvania in the fall, it's top notch. It was blue and crisp and gorgeous leaves, and we make up for it in March when we have gray days for like 60 days, which is so yeah.
Yeah, I think we do the 40 days and 40 nights every year in Vancouver. So we're all pretty adept at building arcs. And in my arc, I have 5 cats living here. How many critters have you got living in your arc?
Right now in my arc, I have 1 dog, 2 cats, and a miniature horse.
Ha! There you go. So you've got a broader spectrum.
Soon to have 2 or 3 more horses here because I want to go muck stalls as my workout.
There you go. That's pretty great. So in my clouder, because so you know that the term clouder refers to a group of cats. What's the name of a group of kittens? Do you remember what that is, Liz?
You got me.
Well, it's also something that you can read a book on. It's a Kindle.
Oh.
So, although I wouldn't recommend putting your book on a group of kittens because it wouldn't stay very stable. Nonetheless, with my clouder, I have no kittens. The youngest 2 are probably about 6, and then they go up to 16 or 17 years of age. And my 3 oldest are all seniors. So I've got a fair bit of personal experience as well as tons and tons and, like almost 40 years of experience as a veterinarian taking care of.
And I'm curious if you had the same experience, that people are very excited when they have a new kitten, but there's nothing like the true love of someone who's had a cat that's been through their whole life together.
Yeah.
And now they're 15, 18, 21. Yeah. And they come in to see you, and that cat means everything.
That bond is so super, super close. And that's, seeing kittens in practice is really fun. And I kind of go like, why would you do it? It's so that it's an insane life. It's like all of a sudden having, 3 toddlers going in 6 different directions, all in one kitten. But that said, absolutely they're fun. They're delightful, but there's nothing quite like, the bond that we have with our older cats. And they just, they have a whole lot of issues. And so this whole month, we're going to be talking about senior cats, right?
And, I came to cat medicine late in my life. I was supposed to be a horse vet. And then I started learning about cats, and I'm like, wait a second. We know so much that I didn't get taught in school. And I became obsessed, and I still am. And so I've been a vet 21 years, so I know less than half as much as you. But I I am so excited about the advancements that we're learning now, because forever we've always said about cats that they're masters at hiding their pain.
Absolutely.
And now we've learned that they're not really. They're masters at hiding it from humans, using the signals that humans give each other to notice that there's something wrong. But if you learn the signs that a cat gives, they actually do tell us. We just
Yeah.
didn't know the language.
Exactly. We were listening in the wrong language, and so let's talk about how the signs of pains in cats, shall we?
Yes, please. And so I was thinking we could start from the big signs,
Yep.
and then we could work down to specifics.
Sure.
So if I'm thinking like, wait, is my cat in pain? How would I know? What would I start to look for?
Well, here's a list of the subtle signs of sickness. Anytime a cat uses urinates or defecates outside of the litter box, it's a sign. It's never spite. It may be something as basic as them telling you that there's something about the litter box they don't like, and think about, is it clean? Has it been flushed lately or not? As in, it should be scooped minimally once a day. Nobody wants to use a poopy litter or poopy toilet. So it could be something as simple as that, or it could be that it's in a location that they're upset about, or they don't like the type of litter, or the box is too small. So those are like sort of toileting things, but it could also be a reflection of stress and distress, that they're not using it. And if they keep, or that they actually have a physical ailment, and if they keep using the box, we won't get it. They need to, it's kind of like a kid tugging on your pant leg. If they don't tug on your leg, you don't even know that there's a problem. So they're trying to get our attention.
This spite thing, just for a second, because it's so offensive to a human. Like peeing on my stuff is a real human offense. And cat pee tends to stink and linger and all those things. So we get mad.
Yeah.
But I want everyone to understand, to take a breath in that moment and say, yes, this is horrible for me, but it's one of the only ways that my cat has to show me. So they're not being spiteful. They're trying to tell you something's wrong.
Yeah, for sure. Absolutely. And they're either crying for help because they're distressed, or they're crying for help because they have a physical issue going on. So
and that part is hard to sort out. So we're going to talk more about that in the months to come. Bridget just said that her cat doesn't like a new litter box because it smells different.
Yeah.
So there can be a lot of reasons, right?
Yeah. So and it could be, I'm wondering with Bridget, is the height of the edge the same? Is it too high for the cat to get in and out? Has the location changed? Has the type of litter changed? Is the depth of the litter deep enough that her cat or cats can dig a nice dip into it so that the urine doesn't splash back? And how is the litter feel on the feet? And
we should come back and talk about it, because what people don't understand is there's a lot of rituals involved for a cat, and from the ability to get in the box, but then sort of the dance that they're going to do when they're in there. So there's a lot of meat in that litter box.
Yes.
Tell me some other.
Sorry, I was just going to say also with litter box, sometimes what cats will do is they'll urinate or defecate, they'll pee or poop right outside the box. And then it's really important to check whether the cat's front end is in the box, but their back end isn't, or whether they're completely in the box, but they don't have that nice arch of their back. And that could be arthritis. Or they could be standing outside the box peeing or pooping there because they don't like the box and they're still trying to go where they're supposed to.
Yeah, they're trying to help you out.
But I mean, certainly arthritis is a big thing in the lower back, in the hips, in the knees, and in the ankles, because they have to really curve their back there. Anyway.
Samantha just jumped ahead and she brought up number 8.
Yeah.
Which was, so we're going to dash around a little bit.
Yeah, let's do that.
Changes in grooming.
Sure. So there you can have somebody who's obsessively groom, and maybe has even, denuded their, essentially waxed their tummy or over their kidneys or their thighs or wherever it might be, their front arm. And that often is associated with pain or itchiness. It's easy to think of itchiness, but it could also be like when it's on the front arms, it can again be distress, that they're anxious, and it's kind of like chewing your fingernails, only they groom themselves. If it's on the tummy, it could be bladder pain. It could be if it's over the back, it could be kidney pain. So over a joint, it could be pain from that joint. It could also be decreases in grooming, and decreases in grooming really common in older cats, where they've got because they very common for them to have dental disease. It may and therefore it may hurt, or their saliva is thicker and gooier, and so when they're grooming.
Yeah. And in those cases, I think the first thing that you see is, I call it the spiky hair coat. Like all of a sudden they've gone from silky to spiky.
But also matted, like they'll be matted.
I always think that's next. I always think that's spiky.
Yeah. Except the spiky can also be dehydration. So we want to be aware of not.
Don't lump it.
Thinking that it's just dental disease, because you can also and icky saliva. But certainly there's also, if you've got arthritis or if you're really overweight, you have a hard time reaching the back, the just above the base of the tail, so the lower part of the back. So there may be clumpy mats there. It can also be
a kitty dreadlock.
Dandruff there.
That kitty dreadlock down.
Yeah, dreadlock. That's a good one. Yeah, exactly. So that's and the other thing with changes in grooming is you may also see them puking up more hairballs, and that's and hairballs are never normal, never ever. Just like vomiting is never normal for cats. There is something going on.
We just think is being a cat.
Yeah,
it's not.
Or to puke. No, it's not. Exactly. It's no more normal than it is for us. So, yeah. But that's not specifically senior cats or subtle signs of sickness. So do we have any other of these being poked at, or shall we get to go through?
No, let's just go to number 2.
Sure. So changes in interaction, it's just what it sounds like. That's maybe they're interacting more or less with people or other critters in the home or their environment. And and it could be they're more clingy, or they're more aloof, not aloof, but more withdrawn. Changes in activity, same sort of thing. The decrease could be really gradual, or it could be abrupt. Depending on what's going on. If it's and when it's gradual, a lot of times people think, well, it's just they're just getting older. No, just getting older does not equate with slowing down.
I remember in vet school, like I had a brain explosion when they said old age is not a diagnosis.
Absolutely, it's not a disease.
It's not a disease.
It's not a disease. Absolutely not. And there's, there has to be a medical reason for that slowing down. And there's lots of things. It could be dehydration. It could be pain. Again, not just joints, but other things. It could be, also from changes in electrolytes, like low potassium or something. There's all kinds of things. And also with an increase in activity, sometimes we'll get, one of the ones I love is when somebody brings in an older cat and says, gosh, look at how great he looks. He's finally lost all this weight that he's been carrying. Doc, the food you've been making me buy, thank you for the blackmail comment, making me buy for him to lose weight for the past 2 years, let's rub it in a bit more, is finally working. And he's so energetic at 15 years of age. And what do you and I think when we hear that? Weight loss and increased activity in an older cat?
You better get some blood work because you're probably hyperthyroid.
Exactly. So, there's that true. And, also, hypertension possibly as well, but absolutely hyperthyroidism is the number one differential there. Decrease in activity could also be from diabetes, just not having any energy. Changes in sleep.
That's the flip, right? Because if we're losing a lot of weight and we're lethargic, we don't want to get the blood work. Because there's no way to know 100% with guessing. But I think more kidney disease, cancer, or diabetes, if we're losing weight and sleepy, if we're losing weight and energetic, hyperthyroid, and even though that's, like you said, that seems great, it's not, because that elevated metabolism is hurting the organs.
Oh, it's really tough on the organs, especially the heart, but also it pounds the kidneys, it pounds everything. It makes your kidney function look better, but it sadly isn't. Then we also have like changes in sleeping habits, and those changes in sleeping habits could be Changes in sleeping habits could be that you're sleeping more, you're sleeping less, you're sleeping in different locations, you're sleeping in different positions, and those can again also be tell you about things, as well as like with if you're FIV, feline immunodeficiency virus positive, you can have for instance have problems sleeping. Nighttime yowling is I think I talk about that next week. We're going to do a much longer presentation then. So I'll leave that as a dangle. But there's also, and changes in food and water consumption. So same thing. It could be increase, it could be decrease. And it tells me different things. We need to pay attention to them. With the increase, if it's an increase and they're gaining weight, or versus if it's an increase and they're losing weight, but also how they're eating. Did they always finish off the bowl and now they're nibbling at it instead, or vice versa? And then with water, are they drinking more? Are they drinking less? Have they started drinking from weird places like that they didn't used to drink from? So we're really talking about changes. So it really, really helps to make a conscious note of what's your cat always done from earlier times too.
Which is tricky, right? Because you can't take one point in time and say, here's what my cat's doing, so here's what's going on. It's changes and trends that we need to watch over time. So yeah, we need to look at the whole picture.
Yeah, exactly. And yeah, so thanks, Samantha. You're going to have his teeth checked. That's excellent. Which, bad breath. Sometimes the little kitty kisses that you get, or you're giving your cat kisses and you kind of go, hooey. But that's not just from teeth. That could also be if they've got problems in their intestinal tract, upper intestinal tract, or their lungs, and things smell pretty gross from that. It could also be from maybe they've got have been trying to express their anal glands, or they've got some other skin disorder. So kind of all gross things. Unexplained weight loss or gain, we've talked about that. Well, bad breath, you got to think about wearing masks, right? With all the masks we're wearing, like, yeah, no, this isn't so great right now. I'm not enjoying this. So unexplained weight loss or gain, we've already talked about that. Unexplained weight gain could be from fluid rather than calories, right? Body fat. Changes in grooming, thankfully that, Bridget already addressed that. Signs of stress might be things like tail flicking or ears a little bit lower. And we'll talk about facial, the grimace scale in a couple of slides if we get there. And just, a cat being just a little more, just kind of catty. And then changes in vocalization, which is, nighttime yowling, which again, I'm going to dangle for next Thursday, is that? Next Thursday. Changes in tone, pitch, urgency, frequency, what they're saying. Are they saying, hey, 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 all the time, or up, 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 or whatever it is they're saying, so those are, we're really looking for changes there.
Yeah. And I'm so glad we're getting questions. So I don't know that this particular question fits in another spot. So I'm going to ask it now. And a lot of people ask this. And I have to say, as a veterinarian, I question myself about this. Zafrina, which is the most beautiful name. Right. Zafrina wants to know, her cat is old and she's worried about getting a full mouth dental at that point. So
yeah.
So A, what else can you do if you can't put them under for a dental?
Well, but B, there's no reason that you can't put them under for dental. I mean, it's any age cat can be anesthetized. The oldest cat I anesthetized for her to have her teeth done was 28, and she had diabetes and kidney disease as well. There's no reason. I mean, if you do appropriate perioperative care and support them before, during, and after the anesthetic, there's no reason it can't be done. So
the question here is the level of care for the anesthesia. And so maybe your local vet, if they feel nervous about it, isn't the right spot. Right. Maybe it will be better to go to a hospital that has people that are boarded in anesthesia, or a feline hospital where they're really up on safe anesthesia for older cats.
Well,
There's other shifts, right?
Zafrina said he's got level 4 heart murmurs. I'm not sure what level 4 is. Not a term. It's probably meaning grade 4 out of 6. I'm not sure. But heart murmurs, again, isn't something I would have an echocardiogram done to check that out and find out what the issue is there. And then you think about it, Zafrina, who are which age group in humans is has the most surgeries for hip replacements, for knee replacements, for femoral fractures, fractured legs, for heart bypass surgery? It's people, and these are like older people, and so these are the age has got nothing to do with it. And you think about people who need bypass surgery, they've got life-threatening heart disease. In order to need this procedure, absolutely it can be done, but it needs to be done. And I don't blame your veterinarian one iota for being nervous about that. But I would, that heart murmur may need to be worked up more. You had an echocardiogram done, that's great. But you need to have an ultrasound of the heart, really. So that needs to be done ahead of time to see which drugs are going to be the safest to use. And I would look for, and it depends on where you live, whether you have access to a specialty group, referral group that has a board certified anesthesiologist or criticalists who can monitor for heart disease or heart disease under anesthesia.
There can be a lot to it. As a veterinarian in a smaller clinic, we're doing the surgery, we're taking the x-rays, and we're running the anesthesia. And so it might not be appropriate for us to do a complicated anesthesia case, but that doesn't mean it can't be done or shouldn't be done.
Right.
And that's okay. We just need to find the resource that can do it.
Right.
So we need to broaden our thinking a little bit in these older cats for where we seek care. And it's totally appropriate for a local vet to not want to get into that, but that doesn't mean it shouldn't be done. So, hey, you guys, since I'm talking to all you, I want you to also know that I'm going to give away one of my hunting feeders. So if you can give me a comment, maybe your favorite cat pun, I'm kind of thinking.
You're making it tough.
At the end, the folks at Basepaws
categorically catastrophic. That would be if you can't come up with one.
Look, listen, I'll have to send you a cat feeder if you keep giving me such good ones.
Like these fantastic ones I already have here.
Thank you. And we can talk about those in older cats too, because use it or lose it, right? So so just put in the chat right there, Bridget, your favorite cat pun.
Bridget, exactly where you're commenting, right there.
Yeah, right there.
Yeah.
We have so much to talk about, and we don't have all night. We're supposed to do the hour next week, but there's too much to talk about right now. So we're going to keep going. Can you talk to me about what's normal for an older cat in terms of getting around? And what is it like we're starting to think, we can help, we can do better?
Right. So with mobility, here we've got, the healthy cat is in yellow or orange, whatever you're seeing there. The purple cat, the cat in purple is the one who's got pain. And this is regardless of age. And so we can see here that what's normal for a cat, cats can jump like 10 times their height, which is amazing. So normally they can jump up, they can jump down without any hesitation. They can race up the stairs, they can race down the stairs. They play like crazy, so these are all different joints, right? Jumping up is back end, and running up the stairs, running down the stairs or landing is front end. Playing is their arms, their shoulders, their elbows, right? And wrists and things. But what people often think is that older cats don't play. He's just getting old. That's incorrect. That if you've got a cat who is either playing less or is using a chair to jump onto the table, or is hesitating when they want to jump down, or is kind of ka-thunk, 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 ka-thunk up the stairs rather than zooming up the stairs. That is, that I'm thinking about discomfort. And even though we're talking about senior cats today, this degenerative joint disease starts in cats as early as 1 year of age.
And that is
It's
impossible
mind-boggling.
to brain around, right? Because they're even a cat with degenerative joint disease up to a certain point can be very agile, and they're not limping like me or like a dog or like a horse. So lameness isn't really appreciated in the same way.
Yeah.
Like we have these other cues that we look to that we're used to of limping, really.
Yeah.
And a lot of cats with arthritis don't limp.
No, they just lie around. Because the thing is, we're looking for different cues. When we take when a person goes out for a walk, or we take a dog out to play frisbee or catch or whatever, we do that. But with cats, we don't do that. Right. So therefore, we're not seeing that because the cats, and if cat's painful, they just don't move as much. So I
just want to ask you also, so you're telling me that if a cat doesn't want to play anymore, or like it just kind of is very unenthusiastic about it, it's not because they're too sophisticated.
Oh, no. And there's differences in personality too, of course, but there's also and there are other reasons why maybe that cat's painful from being dehydrated. Dehydration is painful. Dehydration is what a hangover is. A hangover is dehydration and acidosis. And
I wouldn't know.
No, of course, no, I wouldn't either. I mean, you and I never, ever, ever drink bubbly together, ever. No.
Except always.
Except whenever we have.
Next time, maybe next week.
I can't wait. I can't wait. So we've talked about accidents, and it could be. I think it was the comment regarding the litter box. I mean, you look at how high this edge is, and when you look at the height of this litter box, that's higher than the cat's tummy. A lot of times the litter boxes have like a 4-inch or 4-inch height, which is, how can any cat possibly it's effort to step over that. If we had to clear a fence with no style, steps to clear a fence every time we wanted, like clearing essentially a baby gate just to get in and out of the bathroom all the time. So anyways, but it could be that, but it could also be, it can also be that the cat has to climb stairs or either up or down, and they have arthritis.
Yes.
So we have to.
So many litter boxes are in basements.
Yeah. What's that about? We need to have at least one on every level, so that it's easy for the cat to get to. And the other thing too is, if it's in the basement, you don't know how dirty it is. If it's hooded, you don't know how dirty it is. And I don't know about you, but I hate outhouses. Going into an outhouse is pretty disgusting. And that's what we're asking our cats to do. And they've got about a 200-time better sense of smell than we do. So
because if they were outside, they would not be choosing the same location to use the bathroom every time. Right? They would go to a fresh, clean spot. Yeah. And also they would choose whether they're going to cover it or not cover it, depending on what information they wanted to give. Like bathrooming, we think of it as so simple, but imagine I asked you to go to the bathroom in the toilet in the middle of my living room.
Right.
That wouldn't be okay.
Or here's the other thing, and this happens to us all the time in the days land before COVID, where you go to a movie theater, or you'd be in a conference in a hotel or something like this, and you go to the bathroom, and at the movie theater, of course, there's a lineup outside for ladies. But other than that, so you go in and there's a cubicle, and you open the door and it's not been flushed. What's the first thing you do?
Let's go to the next one.
You go to the next one. Why? We have the ability to just turn around, close our nose, and flush it, but we don't. Yeah. And so, and we're not giving, cats that, and we don't even have the same sense of smell. We're not going in there in our bare feet and coming out and licking our feet afterwards. So it's just, toileting. I'd love to do a whole thing just on toileting. Super important. But there's other behaviors that indicate pain too.
Yeah.
Should we talk about those?
Tell me.
Okay, so here, reaction, like if when you palpate somewhere, when you touch,
or pet, just cuddle,
just stroking, if if they're kind of wincing or pulling away, or they themselves are completely withdrawing or hiding, a decreased appetite, which can mean so many things. I mean, there's really only 4 signs of illness in cats. It's, decreased appetite, possibly nausea or vomiting, maybe diarrhea, throw that in there too, lethargy, and being withdrawn. I mean, that's it. That's all that we have to work with.
Have a
when you
lot of
come to
ways
us.
to show us.
It
Right?
tells me nothing except your cat's not feeling well. So, but tell me by all means, and then I'm going to ask you more questions. Having a hunched posture, kind of like this kitty on the bottom right-hand side, a lowered head position, you can see that too. Different changes in how the tone and quality of their speaking, partially closed eyes or pretending that they're asleep. If any of you, and I hope it's not many of you, get migraines, I know both Liz and I do, all you want to do is have your eyes shut, have the curtains drawn, just everybody shut up and leave us alone. You're just focusing on the next breath, getting to the next breath without puking, right? So decreased grooming, changes in temperament, we talked about those, and then also changes in facial expression. And these can be pretty dramatic. I mean, all of these cats are in pain. And we've got this wonderful tool now, which you can look up at the URL.
I want to just pause here, There's my pun. Do I land?
Nice, very nice.
I want to pause here and say, when I first heard about this, I was like, what sort of nonsense is this? There's no way. And the more I learned about it, and actually it's like anything else. It seems impossible until it's not. And then it's familiar. And then it's like, oh my gosh. So I remember probably, well, you were probably doing the research, but I used to get emails from, I don't know if it was the AFP, maybe it was.
American Association of Feline Practitioners.
Which is our governing body, to say, here's loads of pictures of cats, which ones are in pain. And I was terrible at it. So all they would show you was what you see here is a face. And I'm like, I can't tell from just a face. When I think about a cat, I think about the whole body. I think about the behaviors. I don't think I ever thought about the face. And when I would go into a cage to get a cat at my job, if they were like, ugh, I'd be like, oh, that cat is mean. Like, wow, not at all.
Not at all. The reason cats, the 2 reasons that cats are self-defensive in clinics, because they're not aggressive, they're self-defensive, is because they are either terrified, okay, or they're in pain, or both. And that's it. And so we need to look at it completely empathically. And what Dr. Stegall and et al. Have done at the University of Montreal is develop this feline grimace scale, which is really fantastic, where, AU being action units, and they're like looking at a scoring these action units just on the face. And but we do need to be somewhat careful. And I'll talk a bit more about this next week, but we do need to be a little bit careful, because this could just be a cat waking up in the middle here. But if they're looking like this frequently, see, what we're looking at here is the aperture, or how open the eyes are, the position of the whiskers. I'm better over here with this cursor here. The position of the whiskers and the positioning of the ears. And as someone becomes painful, their ears go more and more out to the side. As they become more painful, their whiskers start getting pulled back, and their eyes start getting more closed. They start looking more squinted. We also look at the whole body. We also look at how they respond to touch and these sorts of things. But this is really, really important stuff. And and as I say, I'll talk more about it next week.
It's sort of like a Rosetta Stone, really. I mean, the more I understand this, I'm so excited that we've developed this tool. Well, you all have developed this tool. So I want to go over it one more time, and I'm going to use my hands because I can be a cat. So perky, going forward ears is what, and they could be listening and all the things, but this is a cat that in that way is showing us that they feel okay. When the ears start to do this, then that's a cat that's not feeling great. And if they go flat, they're really struggling.
Or they're totally terrified.
Right.
Because the signs of them being terrified are somewhat similar too, in that when they're terrified, they're essentially just trying to make themselves smaller and less of a target and more invisible. So their ears, if we look at the face of a cat who is terrified, it looks like the face of a dog who we traditionally have been saying is aggressive and dangerous. And so we've been misinterpreting it all this time. And turns out we've been misinterpreting it in dogs too, but that's for others to talk about, not me.
Yeah, so we've got the ears and then we've got the eyes. So when you think about signs that things are good, in general, now I want you to talk a little bit about, there's nuance here like everything else, right? But a nice big round eye that's relaxed, in general gives a signal that things are fine. And as it goes more and more almond shaped and flat, that's a cat who is suffering.
Yeah.
Right?
Yeah, for sure. And I think a lot of the times, when you look at a person who has a headache, you can tell. You see it sort of in the tension right in the periorbital area, this area right beside the, and it's the same in cats.
And if you're really familiar with someone, my kids will walk into the house after school, take one look at me and be like, "Oh, Mom, you got a headache?"
Yeah.
I'm like, but I look different.
It's right here. That's where you see it. And, and the clenching of the jaw too. And that, brings us to the whiskers, right? Whiskers.
This is fascinating to me. Explain.
Whiskers. People don't pay enough attention to whiskers. Whiskers are so important for cats and for so many reasons, but also for us in interpreting pain. So whiskers like this, happy, the more they go back, and drooping and separated. It's essentially, it's about their cheeks, their muzzle getting more and more clenched. And the more clenched it is, kind of like if you grind your teeth or clench your teeth, then those whiskers come more forward. So really, Catherine's posted a really sad thing here. I'm so sorry about that. That's great.
Yeah. And this is the thing with our older cats. I mean,
yeah.
Catherine, it sounds like you really tried to do everything that you could, and I'm so sorry.
Yeah.
I lost an animal this week too.
Yeah, I know.
And so my heart is with you. If you're not an animal person, like,
you wouldn't be here.
Well, right, but it's hard for not animal people to understand the depth of the loss. So my heart is with you. Yeah. If I keep going, I'm going to cry. So let's
just keep on moving then, shall we? Let's not have you move.
Her cats. Well, I just want to say this because we talked about nuance, and Bridget says that her cats are squinty-eyed all the time. Yeah. What do you make of that?
Well, I think that when you're talking about, I mean, some cats, it's just like people. Some people's eyes are very round, and some people's eyes are less round. And then there's also differences in, not cultural differences, but racial differences, which in race and breed are essentially the same thing. So different breed differences as well. Not that I can draw any. I would say that Siamese eyes may not be quite as round, but I don't know that. I'd have to look at a whole bunch of pictures to really, because I've not thought about that. Have you, Liz?
I have not thought about that.
Yeah.
And there can be eye issues that changes too. But what you're saying is number one, we want to look at changes from normal. So if you're always squinty, and you don't think that, you can ask the vet, have they always been in pain? But it's a change from what's normal for them. And then the other thing is we look at a lot of different things. So are the eyes squinty, but where are the ears? And where are the whiskers? And are they like floppy and loose and relaxed? Or are they, clenched and sort of protecting themselves and guarding? So any one of these things can be misleading if you don't look at the whole picture.
At the whole picture, for sure. Yeah. And Rayleigh, I will get to your comment there, but I wanted to just look at a couple of other slides here. So even perfectly healthy cats, like medically, physically healthy cats, can develop sickness behaviors if they are distressed. And so therefore we really need to, and cats who are strictly indoors spend a lot of time distressed because they don't get to do normal cat-like behaviors. They have everything provided for them, but they don't get to hunt and kill. They don't get to climb trees. They don't get to chase leaves. There's so many things they don't get to explore and things like that. So it's really important that we meet their environmental needs to decrease stress. And so even these healthy cats may present with signs, clinical signs of things that we think of as being physical, the representing physical things. And like the classic one is interstitial cystitis, the most common cause of lower urinary tract disease in cats. Over 65% of cats all across all ages have the cause of lower urinary tract disease is psychological and immunological. And
I got to pause on this one because I can't tell you how many people I hear from that say my cat has a UTI.
Yeah.
And we got to walk a lot of steps back from that.
What urinary tract infection. Yeah.
My cat is peeing outside the litter box. That does not equal a urinary tract infection. When we say UTI, that means a bacterial or I guess viral infection.
Not viral. They don't get any viral infections.
Yeah, I'm like, yeah. Well, I guess
they don't get any. They don't get any urinary tract viral infections
that we know of. So when we think about it, the odds of in a cat between 1 and 10, the odds of that peeing outside the litter box being from emotional stress and distress, you said is about 65%. The odds of it being a bacteria,
that tends to be that's across all ages. The idiopathic cystitis occurs primarily in younger cats. Cats over 10, which is who we're talking about now as senior cats, as cats over 10 years of age. They are more likely, that they are the age group that is most likely to have bacterial infections. But even then, bacterial infections are far less common than being diagnosed, and therefore, we're using antibiotics where we shouldn't be using antibiotics.
And you know what I don't think it's done enough is either an ultrasound or an X-ray, because stones are far, far more common than a bacterial infection.
Yeah.
They're more like 10 or 15%.
Oh, way more likely. Way more likely. So idiopathic cystitis is one thing, but then also even things like, so that would be, peeing small amounts, increased frequency, blood in the urine, in peeing in abnormal places, straining when they urinate. But vomiting, diarrhea, anorexia, decreased food or water intake, fever, even lethargy, being sleepy, enhanced pain-like behaviors that we've talked about, and decreased activity, decreased grooming, decreased social interactions. Those can all be psychologically induced.
So, one of my favorite things I'm thinking about in humans lately is the expression psychosomatic, because it doesn't mean you're crazy and you're making up your illness. What it means is it's so good. Mental health is so important to your physical health that when your somatic system gets overwhelmed, you actually truly develop physical problems.
Sure. And it's your immune system and your neurological systems that there's crosstalk going on. And so you have, truly, and we're seeing this so much with COVID, right? With all of the changes in our lives associated with that. Yeah, anyways, we could talk forever on this one. And actually, but we won't right now. So
I just want to pause before you move on to say, what does that mean? How do we deal with cats' basic needs?
We need to that's a whole thing where we need to make sure that they have this, and it doesn't really fit in with the senior theme, but all cats need to be able to.
I'm going to send Basepaws has it actually, and I'll make sure that it gets posted. The basic needs of cats. It's not just a litter box.
5 pillars that. Multiple and separated resources, as we talked about with litter boxes, that there's at least one on each level. But you need to have, if you've got, and in addition, if you've got 3 cats, you need 4 or more litter boxes, and they can't be side by side. Then you need 4 or more water bowls. You need 4 or more food bowls. And guess what? Food and water shouldn't be side by side. And you need 4 or more scratchings, et cetera, et cetera, et cetera, because cats are very territorial. But it's really, and I'll address that. I think I touch on that next week. I'm not sure.
Well, I mean, I've talked about it here a lot, and we can't stop talking about it enough.
Yeah.
And that is why I heard from you, Dr. Margie Scherk, changed my life when you said, what's the number one cause of death for cats? And the number one cause of death for cats is euthanasia. And the number one cause of euthanasia is a behavior problem that gets you sent back to the shelter.
Yep.
So we cause it. We
Yep.
cause it because we don't understand. This crew here,
Tragic. It's tragic.
it's I changed my whole life because of that, because of you.
Sorry.
but this crew has been lucky enough to have wonderful cats, or is wonderful enough person that was committed to managing through some hardships, and so they've got this geriatric cat, and bravo you.
Yeah, exactly.
So how is our crew here going to make sure that that their cats are getting what they need in terms of pain management, in terms of diagnosing these diseases? What do we do?
Well, as is said with not just breast cancer, the best protection is early detection, which means that we want to make sure that our cats, when they're 7 to 10 years of age, they're seen at least once a year, and have blood work done at least once a year, and a urinalysis. And when they're 11 and up, every 6 months, and over 15, we might even be talking every 4 months, because we're really talking about, and we'll look at the scale of how cats age relative to us next week, but we need to be bowling a comprehensive physical examination and consultation, including blood pressure. We need to be doing serum biochemistries and a complete blood count, thyroid hormone level, and a urinalysis. And then 10 years of age and up, we want to be doing x-rays, like you said, Liz, once a year or so, because not just looking for stones in cats who are urinating inappropriately, but because cats, as they get older, may have stones in the upper urinary tract, which doesn't affect how they urinate, but it can really impair their kidney function. So that's why we need to be doing these things this often.
And I'm going to take a second here to say, it's not cheap. Nope. I'm so used to, I pay my terrible insurance premiums, but when I go to get care, it's a copay, and I still don't even like that. Right. And you can't get insurance on a senior cat. They're not going to give it to you.
You have to have insured them. Yeah, boy, don't I know. I spent on one of mine was $20,000 last year, and the other one has had 3 surgeries this year. Another one has had 3 surgeries this year to the tune of about $21,000 this year. So yes, hey, I know. Yeah. Samantha's asked, do indoor senior cats really need their rabies shot? It depends on where you live. So if you live in a place where rabies vaccination is mandatory, then it's mandatory. End of story. Because also indoors only, we think of them as that the cat may never hit, their paws may never hit the grass, but that doesn't mean that creatures that carry rabies don't somehow get inside or on the balcony.
Like bats. Bats get inside all the time.
Absolutely. Absolutely. And Bridget said, weren't able to do blood work on my senior cat last time we brought him into the vet because he lunged at them and brought him back out.
This is super important.
Yeah, this is where we talk about feline friendly, and it may be that giving some gabapentin ahead of time and go as a fear-free practice would recommend but it's all about the handling. And honestly, God, there is no cat I can't examine. And I examine them on my own with nobody else holding them.
And it makes it a whole lot easier if we've done carrier training. And so that carrier's out all the time. And the cat thinks the carrier is their safe space, not the tunnel of doom. Yeah. So we want to carrier train, and we want to look for a veterinarian who specializes in cat-friendly handling and fear-free, so that we minimize that distress. Distress isn't good for anybody, but it's certainly not good for an old cat. I want to talk a little bit, I guess maybe at the very end, of how if your vet's not working for you, or for your cat, and I would say, Bridget, your cat did not enjoy that visit, how you can find someone who might be more skilled at handling a fearful cat.
Yeah. Yeah. Um, so, Bridget's asked about gabapentin used for sciatica. I'm sure it's the same. We're not here we can't recommend using your drugs on cats. And so I'm not even going to tell you a dose. So next thing, you need to talk to your veterinarian about that.
But it is the same drug, and we use it for nerve pain, but we also use it because it provides this really nice, gentle relaxation.
Anxiolytic. It decreases anxiety. Yeah.
And there's a lot to it, to that, where we want the cat to actually have a good experience and learn and remember this good experience. So a lot of the drugs we used to give would make them just whacked out. And gabapentin is working really, really well for all those reasons. They remember their experience and they're chill.
Yeah.
Tell why these accelerated visits? Why can't I just do my once a year?
Because, we've talked about how cats hide the signs of illness, and we often don't recognize the signs of illness. And the signs of illness can be very, very gradual. And then there can be like you stub your toe on the road and then you crash down. So those changes can occur really quickly. And like I'll really focus on next week is early detection of weight changes is so important. If you were to buy one thing for your cat this year, I'd say get a baby scale.
Wow.
And weigh them once a week. Really, really important.
It's so hard to tell until there's a big change.
Oh yeah, because I mean, if you're only 11 pounds to begin with, okay, and you lose 10% of your weight, that takes you down to 10 pounds, right? But if I lose 10 pounds, that's 14, or if I lose 10% of my weight, that's 14 pounds. Very noticeable on me. Would love to do that, but that said, you're not going to, so really noticeable on me, much less noticeable on kitties. So you have to do a percent weight. You look at it for a percent weight change. Because if you say we've lost 1 pound, yippee skippy. Yeah, 1 pound on an 11-pound cat's a huge difference. Some of the things too that we'll find on screening of apparently healthy cats of ages 6 and up, was in this one study of 100 cats. 8% of these apparently healthy cats had hypertension or high blood pressure. 20% of them had enlarged thyroids. 3% had actually increased thyroid hormone levels, were truly had hyperthyroidism. 25%, which is a huge number of them, had protein in their urine, which is a very bad thing. 14% of them were feline immunodeficiency virus positive. 32% of them had enlarged submandibular lymph nodes. Those are the guys under here, and that will be because of dental disease. So that doesn't surprise me. 11% of them had heart murmurs, and mostly heart murmurs are benign, but nonetheless, we need to know that they're there. Azotemia, which is an increase in kidney enzyme values, as well as they can also be a reflection of dehydration in 29% of them, and then increased blood sugar and sugar in the urine in 25% and 3% respectively. And some of that may have been from stress, but it won't have been all of those cats. Some of them will actually have had early diabetes.
And I want to say I'm guilty here because I don't really want to know when there's something scary, and a lot of this stuff sounds really scary. So I don't want to know. So I'm just not going to take them, because then it's not real if I don't know.
Sure.
What I want people to really understand is a lot of these things, if we catch them early, we can do something to make your cat feel well and extend their life.
Yeah.
It's a big deal.
Yeah.
We're not just going to find something scary and tell you, here's your scary news, now go home. Yeah. What we're going to try to do is help your cat feel better and live longer. So knowing these things is really important, because if we don't know them and we don't care for them, they progress more quickly. They make your cat's days harder to get through, and they shorten your cat's life.
For sure. For sure. Catherine's asked, do indoor cats need heartworm testing and preventive medicine? Absolutely. If you live in a region that has heartworm, where mosquitoes carry heartworm, indoors or out doesn't matter. Mosquitoes don't care. Even if you have screen doors, when you open those doors or windows, the mosquitoes may come in. And cats living in areas with heartworm, where dogs can get heartworm, need to be treated with preventive care for heartworm, same as dogs. So back to weight, because we are so massively over time. It's just great. Changes in weight, super, super important. Get a kitty scale. Yeah, Catherine, exactly. Treatment for chronic kidney disease, extra 10 years. Spot on. That's exactly. Kristen said regular diagnostics show trends, and these are critical to pick up subtle changes before you hit that, before you stub your toe in the road and have a crash and burn. And then it's a real problem. So we talk about, body condition scoring and also muscle condition scoring, and body condition scoring talks about if there's enough calories in a cat's diet. And so here, this would be the ideal body condition. This would be too many calories, the right amount of calories, too few calories. But then, and what we're trying to pick up are these decreases in body condition scoring. But it's easiest way to pick it up is with the scale. And then also you can learn how to, if you go to the World Small Animal Veterinary Association website, wsava.org, and go under guidelines, and there you'll get the nutrition guidelines toolkit. And in there, it's got exactly how to do this. They also have about muscle condition scoring, because muscle condition scoring is there enough of the calories that the cat's getting coming from protein or not. Because if you're losing muscle, if you're using your own muscle, it means you're not getting enough protein in the food, or you're needing extra protein that you're not getting, and or you have some catabolic disease. Again, we'll talk about this lots and lots next week.
Yeah, so I think this deserves a lot of time, because they're really they're great tools, and you can learn them. So we have a lot to talk about, and we're going to be back. So we'll be back on Thursday the 18th. And if you had a good time,
same time, same place, right?
Yeah. Well, today's Tuesday.
Yeah, but same time of day.
Time of day, yes.
Yeah, same time of day.
Same time of day. Yep. And if you register, you'll get a reminder, which is handy, because I may occasionally forget things. And share it with your friends. If you feel like you learned something tonight, tell your friends, because we want to help all the cats. And there's so much that's misunderstood, and so much that just isn't known. And we want to, you guys can be warriors for cats and help everybody get the real information to take the very best care that you can for your cats and for all the cats. And don't forget
a couple of comments that we missed on before you close out completely. Lisa, I wanted to comment on, it's great that your 18-year-old is on pain meds, because you noticed that she wasn't jumping the way she used to, and hopefully those pain meds, non-steroidals, are helping her. Rayleigh, you asked a question about dementia. It's called cognitive dysfunction, is what it's called in cats. And yes, absolutely, this is that's one of the causes of nighttime yowling. But it is as well, sitting in a corner and being lost, or starting to eat and then forgetting what you were doing. It's a diagnosis we make by ruling out other things. Unfortunately, at this point in time, we don't have any treatments whatsoever to slow the progression, much as with Alzheimer's. However, what we can do is make sure that all of their resources are readily available, that we are easy to get to, that we make sure that, we make sure they eat, make sure that they get to the bathroom, make sure that, and just love them to bits.
So we were supposed to join you for 20 minutes. And we're overachievers, let's be honest. We took your hour. So I hope that you had as much fun as I did. And I want to thank Basepaws for providing this incredible outlet to get you guys great information. And there is none better than Dr. Margie Scherk, who has changed my life and changed many cats' lives and the people who love them. So thank you so much for coming. I really appreciate it. And we're gonna have you back next week. So register, tell your friends, and don't forget to give me your cat pun if you would like to be in the drawing for Doc and Phoebe's hunting feeder. Absolutely. And actually, you know what? I'm going to do you one better. You can, if you win, you can choose if you want the wet feeder, which Margie's showing you right now, or you want the hunting feeder for dry food or treats or freeze dried. So thank you guys for coming, and we'll see you next week. Tell your friends.
We might need more than an hour next week.
Yeah,
I have this feeling.
This is the Feline Masterclass, and there might be a lot of episodes. There's a lot to talk about.
There's a lot to talk about. Thanks for caring for your kitties. This is fabulous.
Yeah, thank you guys. We'll see you next week. Bye-bye.